So we start recording now.
Alors, amis, nous disons bonjour matin, parce que nous connaissons le ça, c'est pas le nous négocier avec lui, c'est le KwenSante. KwenSante, c'est une émission UDH Health Coach, et mettez sous pied pour nous capables de faire ça relais éducation. Donc, gagner Joint Committee for Children là pour Everett, yo abréviation yo c'est JCCHACE. Donc, c'est une organisation qui est là dans la communauté qui peut faire éducation. Donc, c'est peut-être ça qui fait que nous, qui ensemble avec eux pour nous porter éducation pour matin, docteur, nous connaissons ou déjà, là déjà, préparé. Bonjour et qui ça ou gagné pour communauté nous.
Bonjour tout le monde, bonjour Aliko, bonjour docteur Moïse, bonjour chers auditeurs, bonjour amis Facebook. Bonjour amis YouTube.
Good morning, Aliko. Good morning, Dr. Moïse. Good morning, Facebook. Good morning, all of our followers on the radio show as well.
Ok, je dis encore, c'est tout un plaisir pour nous là avec nous encore.
This morning, it is our pleasure to be with you again.
Donc, je dis à nous pour parler de la diviser l'heure, ou bien moitié l'heure, et 30 minutes ça en plusieurs parties. Première partie.
Yeah, this morning we're going to divide these sections into multiple parts. The first part is.
Et première partie, c'est un patient que je voyais, il me dit que je profite de la radio parce que j'écoute la radio pour m'expliquer ça, un hernie ombilicale. Deuxième partie, nous allons parler de.
One second. So 1 second. So the first part, I spoke with a patient and I shared that I made a promise that I'd review what an umbilical hernia is.
Et puis après ça, nous allons parler de qui ça que le monde souffre, ça y est le long haul COVID. C'est-à-dire que.
And also the second part is discussing what long haul COVID is.
Parce que il y a un pile symptômes que là on pile monde fin fait COVID, il persiste gagner.
Because there's a variety of symptoms that persist once someone has contracted COVID. It transitions into long COVID.
And then après ça, comme nous avons pile ambition, c'est pas le docteur Moïse qui parle faire une intervention, ou bien docteur Moïse a fait intervention avec moi, elle a parlé de long terme COVID là.
Yes, and so today, Dr. Moïse will also be giving her perspective, the psychological perspectives of what symptoms look like in relation to learning about a chronic illness such as long COVID.
Donc, avant que nous commencions, donc, nous allons parler de hernie ombilicale.
Before we start, we'll start off talking about the umbilical hernia.
Qui c'est les petits moun en Haïti nous dit l'ombrique yo sorti.
When a child is in Haiti, we say the belly button of the child has come out.
Donc, là nous ouais ça, c'est ça y est, hernie ombilicale.
And when I said come out, I meant protrude, like as if it's coming, it seems to be a little bit more notable as compared to others. And so that is what we consider umbilical hernia.
En pile la ti moun yo au fur et à mesure que a grandi, li passe.
A lot of children, as they get a little bit older, that passes.
Et li pas comme si cause gros complications non plus, en général.
And it also doesn't generally cause any severe complications.
Cependant, une série de grands monde qui doivent développer hernie ombilicale.
However, there's a series of adults who can develop umbilical hernia.
Et pour eux-mêmes, ils sont capables un petit peu plus sévère si que hernie en vient ça ou hernie étranglée.
And this can be even more severe if the umbilical hernia becomes an entangled hernia. Is that what you said?
Strangulated.
Strangulated?
Mm-hmm.
Okay, strangulated hernia.
Yeah, là, ça son urgence médicale que lié, c'est pour courir à l'emergency room, pas attendre office docteur à ouvert, parce que son urgence médicale liée.
And at that point, it becomes a urgent matter where you would need to run to the ER.
Là, ça va bien douleur, vomissement, ou capable de la fièvre tout.
At that point, you have pain, nausea, vomiting,
and fever.
And fever as well.
Donc, ombilical hernia, ça lié, hernie ombilicale, ventoux.
The umbilical, what the umbilical hernia looks like, your stomach.
Ventoux gagne une couverture de muscle là.
Your stomach has a covering of, what's
muscle?
Oh, of muscles. So your stomach has a covering of muscles around it.
Et c'est plusieurs muscles qui rencontrent ensemble qui intriqués, qui viennent fermer, qui viennent pas ouverts.
So it is the gathering of the muscles that become a bit intricate and they have difficulty opening up. So they're all closed around the stomach.
Yes. But when you, mais là nous gagne hernie ombilicale là, c'est comme si votre la fond gagne des muscles qui viennent pas connectés encore.
But when you have the umbilical hernia, the muscles have a division. It's not all wrapped up together. There's a opening or a break.
Et puis ça crive kounye triple sorti entre vin paraître le muscle.
So what happens is your
gut.
Okay, so what happens is your gut protrudes out and it's exposed outside of the muscles.
Yeah, outside of the muscle. You don't see it because there is still the skin.
Still covering, yeah, okay.
Donc, les comme ça, les triples sorties, je fais que je dis ça en anglais, ou même ou pas, ouais, triple sortie, mais ou on boule en ventre, et l'autre tout c'est qu'on y est, boule la sortie, il vient paraître plus.
So, as Dr. Jean-Baptiste was just sharing, when you have that protrusion, you don't see it, but sometimes if you may cough, you may feel it may come out, and then I think I missed the last piece of that. Was that
it?
Oh, so it might inflate such like a balloon.
Yeah. La plupart du temps, triple a retourné en place.
After a certain amount of time, your gut kind of goes back in place.
Mais si qu'on y a l'irrité, pour some raison, l'étrangler, c'est là ça a un problème.
But if there's any reason as to why it triangulate. So you mean come together, or
it's like it's like choking.
Oh, okay.
The intestine are out and they cannot get in again, and then you have, because of that, there is decrease of blood supply.
Okay, so it's kind of squeezing as it's protruding out, and it's difficult for it to kind of come in. So some like the muscles around it have to open up. Is that kind of
Yeah,
what?
they not,
Okay.
for some reason, they cannot go back. And
Okay.
then when that happens, you have lack of blood supply.
Okay.
And then that's why it's dangerous.
Okay. Thank you.
Donc, c'est ça hernie ombilicale là. Donc, la plupart du temps, les gens qui ont hernie ombilicale là, son grand monde, sont bonne idée pour référer par un chirurgien pour ça eux-mêmes y a dit sur ça.
Mhm. So that last sentence, can you repeat that again?
I'm saying that that's what the umbilical hernia is. And whenever you, as a primary care doctor, see somebody with umbilical hernia, it is an adult, you may want to refer them to see the surgeon.
Surgeon, okay. Gotcha.
Okay, that's it for umbilical hernia.
Okay, thank you.
Donc,
Sorry, the medical terms can be a bit difficult for me to know.
I know.
Explain in Creole, in English, I mean. Okay.
Donc, Kounia, nous parlons virer sous question de long-term COVID.
So now we're going to transition into the conversation of long-term COVID.
Donc, terme long-term COVID, nan te commencé dans social media. Kote gen yon moun ki rele Perego qui te parle de ça.
The term long COVID started on social media, where a physician started to speak about it.
No, it was maybe somebody.
Some just
Perego. I don't know what his profession is.
You said Perego?
Yeah, Pergo.
Okay. So someone named Perego started to they termed long COVID.
Donc, symptômes long-term COVID, c'est, alors, faut me dire que 31 à 69% de patients qui te fait COVID capables de développer long-term COVID.
So 31 out of 100 patients.
31 to 69%.
31 to 69% of those who contracted COVID end up having long-term COVID symptomology.
Yeah. Et la plupart du temps, yo suivent moun yo, et c'est à partir de ça, yo suivent là que nous parlons parler de qui symptômes yo.
So they followed some of those who retained some of those long lasting symptoms, and those are the symptoms that we want to discuss here this morning.
Kounya, un symptôme qui paraît plus fréquemment, c'est fatigue.
The symptoms that appear more frequently include fatigue,
tousser,
cough,
essoufflé, shortness of breath.
Okay, shortness of breath. I'm happy you knew I didn't know how to say that.
Palpitation. Your heart is beating fast.
Heart palpitations.
Là, yo dit palpitation, ça veut dire qu'il a bat vite.
Like your heart.
Viré. Vous sentez toute la journée tête ou viré. Lightheadedness.
Lightheadedness, dizziness.
Yeah. Quoi, douleur dans tout corps.
Pain in the body, so body aches all around.
Et difficulté pour capable concentrer.
And difficulty concentrating.
Symptômes ça, je les connais déjà sous le nom de chronique fatigue symptômes. En pile là, yo semblé avec même symptômes chronique fatigue là que tu qu'on parler de yo longtemps.
So these symptoms are similar. They seem pretty similar to chronic fatigue syndrome that I've discussed in the past.
Donc, il y a deux catégories je divise en deux catégories. Il y a une qui dure jusqu'à
So there's two different categories, and one lasts all the way through
all the way up to 12 weeks.
So
the first one, you can have it like a month after COVID, and it may last until 12 weeks.
Okay.
And then there is also the chronic one that may last for a long time.
Okay, so you want to check.
Yeah. Donc, une première partie qui est capable de durer entre 3 à 12 semaines, il y aurait le sub-acute, ça veut dire que il n'est pas arrêté pour tout le temps. Et puis, une deuxième partie, nous ne savons pas combien de temps il va durer.
So the first one is a subacute symptomology, and the second one, they don't know how long those symptoms would last.
So, ça, vous avez remarqué? Vous avez remarqué que les gens qui gagnent post-COVID, les fait test COVID pour eux, la plupart du temps, il est négatif. Ça veut dire que l'infection COVID l'a passé déjà.
Oftentimes, when some of these folks go to get tested, they are asymptomatic and
no, their virus load. The COVID test is negative.
Oh, right. So their COVID test is negative, but they have the symptoms.
But they have the symptoms.
Right.
Mais il y a une catégorie de monde tout qui ne doit pas avoir aucun symptôme là où tu as COVID là, mais ils sont still capable de développer long-term COVID.
So then there's another group of folk who may not have had any symptoms at all and had tested positive, but they have the same long-term symptomologies as well, even though they hadn't experienced any severe symptoms when they tested positive.
Et il y a des gens qui semblaient plus affectés par long-term COVID que l'autre. Par exemple,
there's some people who appear as if they are more affected by long-term COVID than others, for example.
Et une lambda que me oublié du tout que c'est jeunes filles ou bien jeunes mounio, par exemple, ils viennent directement dans période.
One thing that I forgot to mention was that young women tend to have fluctuations in their menstruation.
Et puis long-term COVID là, je pense que en pile de fois tout, c'est comme si son problème auto-immunitaire que mon nan vient développer.
It also appears as though the symptoms are autoimmune related.
Some of them. Donc, ça y aurait les auto-immunes.
What we call autoimmune.
C'est que c'est propre corps qui attaque corps.
It's like your own body is attacking your body.
Et tout, il y a un pile monde tout qui a un problème concentré et c'est là que je passe cette balle là à Dr. Moïse. Et you remarqué que monde qui était dans intensive care unit.
One second. So there's some people who also have difficulty with concentration, and that's where Dr. Moïse can speak a little bit more as well. And there also were some folk who were in the emergency room, you started to say?
No, the ICU, people in ICU tend to have more complication, lung complication, and also memory loss, difficulty concentrating, and maybe anxiety and depression, PTSD. Okay. So that's why that's your turn now.
Yeah. So in thinking about, in general, when we see individuals who have chronic illnesses and long-term COVID is now a newer chronic illness that we're adding into kind of what we're seeing in the medical sphere. The symptomologies, the mental health symptomology. Oh yeah, sorry, I forgot. Was so guilty of this. So let me start over. So long-term COVID is the newest chronic illness that we're seeing currently.
Donc long-term COVID là, c'est une comme si c'est nous gagne toute une panoplie qu'on y vient ajouter à toute maladie chronique que nous gagnons.
And consistent with other chronic health concerns, these issues such as difficulty concentrating.
Et donc, même genre tout, donc, une symptôme, c'est difficulté pour moun n'a capable concentrer.
Is difficulty concentrating is a common representation, and oftentimes because I'm not familiar with this long-term COVID as much, but I can only speak to what difficulty concentrating over time looks like.
Donc, moi même pas tellement deal avec moun qui gen long-term COVID. Yo même qui doit expliquer nous qui ça comment que difficulté concentration manifesté.
And I'm not sure if you know, Dr. Jean-Baptiste, if the article or the research shows that younger children or younger adolescents have higher levels of difficulty concentrating versus adults.
This I don't know.
That you don't know.
But what is brought to my attention is like people who had like already CVA, and so their state seems to worsen. CVA. They have more, I'm sorry, who had a stroke before.
Had a stroke, okay.
Yeah, some of them, their symptoms worsen, and to the point that things they could do before, they have difficulty remembering and doing stuff from themselves that they used to do.
Absolutely. And so consistent with other chronic health conditions like this that worsen, when you see things such as memory loss or difficulty concentrating.
Yeah, and I've seen patients who tell me.
So it's you can you interpret?
Oh, sorry.
Yeah.
I just
because I have to. It's part of a sentence. So consistent with other chronic health concerns that have prolonged symptomology, such as difficulty concentrating and memory loss.
Donc, consistant avec moun qui gen difficulté concentrer avec perte de mémoire là.
There tends to be a high level of adjustment that they may not have been prepared for, that they now have to face.
Yo capable gen un problème pour kounye yo capable ajuster parce que situation yo changé et c'est pas yo même seulement qui pour ajuster. Environnement yo tout kounye pas l'obligé à ajuster parce que moun ça
So that was going to get there.
Oh, sorry.
Yes.
This is why it's a dialogue.
Exactly. So as Malu was starting to say, not only are they adjusting, people are adjusting to their conditions as well, such as their caregivers now.
Yes, so you have the ball.
And then not only are they adjusting, they're mourning the loss of their maybe moderate functioning or high functioning.
Donc, moun sa yo tout, yo gen pile la peine parce que yo pouè que yo perdu pied. Ça yo te kon fè yo, pas capable fè yo encore. Donc, yo ti jan découragé.
Yeah, and so in seeing this, and like I said, I'm not necessarily working with folk who have long-term COVID, but as someone who does a lot of psychological testing, I've seen how difficulty concentrating and memory loss does impact the quality of work and school performance.
OK. Comme moi dis nou, m'pas tellement ouais en pile moun COVID, mais moi fait en pile ça y relè neuropsych testing. I think you probably will need to elaborate what neuropsych testing is.
Yes.
But m'fait en pile test pour mémoire avec qui j'en adapté à environnement et le test m'a fait yo mais ouais qui j'en que le corps perdu force sous concentration le réaliser que conseil de ba ou t'es capable faire qu'on pas capable faire qui j'en ça affecté moralus. That's what you meant.
Yes. And so just a brief statement on psych testing. So psych testing is essentially, you can liken it to your car giving you trouble, but you're not sure what the problem is. If you want to interpret
donc,
that part.
Donc, psych testing, non? M'a comparé li, par exemple, ou gon malade, ou gon machine, ou ap essayer machine conduit, ou ap essayer faire le parti, mais ou pas capable. Is that what you said?
Yeah. Yes, and you don't know what's wrong with it.
Et puis ou pas connaître qui ça passe. Pas connaître qui ça pas capable partir.
So what you do is you take your car to a mechanic and say, hey, can you run some diagnostics to figure out what's going on?
OK, donc ou même ça on fait ça, ça dit aliko, ou machine nan, ou mène li la dealer ou bien ba un mécanicien pour yo même yo porter diagnostic, yo ouais qui ça fait machine n'a pas marché.
And so what I do is when people realize they're having severe symptoms such as difficulty concentrating, or they can't remember things too well, they want to come to me so I can diagnose what's going on with them.
Donc, moi-même, ça va faire, les gens qui ont un problème, ils voient que sont pas capable de penser clairement, il y a plus de confusion, et que, par exemple, si un petit monde n'est pas capable d'apprendre l'école, ils viennent là quand même, et moi-même, je vais faire une série de batteries d'examens pour moi, pour me capable essayer de diagnostiquer qui ça a passé dans le cerveau moun ça.
Yes. And so that is what psychological testing, as we do those.
Donc, c'est ça que psychological test, neuropsych testing.
And so what I've seen, not only with children, young adults, and older adults, is that when there starts to be worsening of symptoms.
Mais ça, moi, ouais, dans tout spectrum, que ce soit petit monde, grand monde, jeune monde, what did you say?
There's now this person is not only having difficulty in school as far as their grades.
Moun sa n'est pas non seulement gen difficulté pour capable monter grade l'école parce que gen difficulté de l'école.
They're also having interpersonal issues with
problème pour yo capable entendre avec l'autre monde.
And in the same way that they're not only seeing like, oh, I'm forgetting this task at work.
Non seulement que yo y a oublié ça pour yo faire le travail.
They also are feeling a sense of inadequacy because of these symptoms.
Yo senti que yo perdu, yo pas content avec tête yo pas satisfait parce que yo senti que yo manque un bagay, yo pas capable accomplir tout ça yo t'a aimé accomplir.
And a lot of times it's not, I would imagine, and I don't want to speak out of turn, Malo, you can tell me more. I would imagine these patients who have long-term COVID, you know, it doesn't come up right away that they're having difficulty. So it's hard for them to understand why they're all of a sudden concentrating.
To corroborate what you were saying, and maybe because we are also closing.
Yeah.
So I am, after reading about long-term COVID, I have some patients who come with palpitation, dizziness, or forgetfulness that they didn't have before. Mm-hmm. And when I look back, those people may have long-term COVID. Mm-hmm. So how long that's going to last, we don't know. Whether or not it's post-acute or whether or not it's long-term.
Right.
I think, I don't know if you were anything just else.
So just a final sentence of, you know, when we aren't clear as to why it is we're experiencing such distressing symptoms that weren't there before, it causes us to, you know, go into another kind of frenzy or frantic state.
Donc, là, qu'on pas fin connaît qui ça qui passé là encore ou et pour qui ça l'a passé qu'on y a créé plus anxiété là car toujours.
Yes. And so that's essentially what I have so far, what I can say on that component of long-term COVID.
Okay, basiquement, c'est ça que je suis capable d'importer pour nous et que je suis capable de dire à partir de problèmes neurologiques que COVID là capable de causer quand on monde. You brought a lot, my friend.
Okay.
Thank you.
Thank you.
So I see Aliko ready to say something.
Okay.
Oui.
So are you going to interpret for Aliko or me? Because he says
n'importe mon Dieu.
Okay.
You do it better than I.
Okay. Alors, dans ce sens ça, nous capables dire que
in this sense we can say
li pi bon pour so ka éviter prendre COVID là.
It would be better for you if you can avoid or prevent contracting COVID-19.
C'est vrai que nous a pas sorti dans l'autre monde parce que nous étions cachés, nous mettons comme dehors.
And it's true that we're entering into another phase compared to before. We were in quarantine, we were at home, and now we're slowly coming out more.
Mais au cas prendre n'importe comment.
But you can contract COVID, you can catch COVID anyway.
Donc, Zami, UDH Health Coach, l'hypothèse KwenSante pour nous.
Well, friends, the UDH Health Coach, UDH brings the Health Corner to you.
Côté pour nous discuter, côté pour nous poser questions, côté pour nous éduquer tête.
A place for us to discuss, for us to educate ourselves, and for us to ask questions.
Merci à toute l'autre organisation qui peut coller avec nous.
Thank you to all of the other organizations who work closely with us. Especially
JCCHCE,
JCCHCE,
JCCHCE, qui veut dire Joint Committee,
which means the Joint Committee,
Children in Everett.
So we know that.
Donc, nous disons merci et nous demandons pour être capable toujours collaborer pour nous capable faire éducation communauté noire.
So we say thank you to you all and to this committee for continuing to collaborate with us so that we can continue to do good work in the community.
Merci, Dr. Moïse.
Merci beaucoup. Merci pour intellectualité et merci pour présence.
Thank you guys. Thank you guys for having.
Merci pour traduction.
Et c'est comme ça on a dit merci avec auditeur nous et on a été soudés et on a clôt parce que
les amis KwenSante.
Oui, exactement. Les amis KwenSante. Donc on dit merci et à la semaine prochaine, week-end prochain. Même l'heure, même station.
See you all same time, same station next week. And thank you. And there was a whole host of people that were thanking. So thank you to everyone.
Okay, bye-bye.
Bye-bye.
Okay.
Oh,